Namaste.
Hello and welcome to the Sikkim podcast brought to you by Summit Times. I'm Tshering.
And I'm Pema Wangchuk.
And we are here to talk about coronavirus, novel coronavirus.
COVID-19. What else can you talk about in these times?
Yeah, everywhere you go, that's the hot topic.
Yeah.
We just like... yeah.
Yeah. That's a nice way to start a discussion on COVID-19.
So, just a disclaimer, we haven't really done like a thorough research on the topic, so...
I think neither has anyone else who's taking decisions.
So we'll try to, steer clear of making any controversial statements, like any...
No, we won't be giving you advice on how you can keep safe, so no Gaumutra from us.
Yeah, so we'll just talk about what's happening. Basically in Sikkim, and we'll just touch upon what's happening around the world and the country as well. So as of now, as I'm looking at the World Health Organization dashboard that they've put up on COVID-19.
Which should be the only place you get your statistics from, really.
Yeah, don't rely on any other source, any media source also, because everybody's going crazy
Except
right
this media source.
Yeah. You just look for guidance. You don't believe in the things they say. You have to check for yourself what they are saying also.
Yeah.
So,
I don't think anyone will take that advice. Given the state that has not even one confirmed case of COVID-19 yet.
Yeah.
But there are a million rumors and claims. Where's my black tea?
Oh yes.
Anyways,
so
let's hear the picture.
He's like
I'm like random rambling.
Yeah, he's extremely good at distracting or taking the conversation away from where it's supposed to go.
Yeah.
So, COVID-19 state dashboard, World Health Organization says so far we have 184,000 confirmed cases across the world. And 7,529 deaths so far, and 159 countries or areas which have been affected, which have reported at least one case.
Just tells you how global every village has become.
And I'm trying to look for some more information of what India's status is. I can't really. So India has 137 cases so far.
Yeah.
And it was just about 2 weeks or a week ago, it had just a few cases reported, I think. So, yeah.
Yeah, I mean, apart from the first 3 in Kerala, then it kind of, for a long time, we didn't hear anything. And then it just kind of... So a huge number have come from Iran, right? Hundreds of Indians who returned from Iran came with the virus. And, that's... But it's like... These statistics, for instance, we're talking at India has how many you said?
137.
137 and 3 deaths. Right? Let's not even get into the whole discussion about whether this is too many or too few, or should we worry that the numbers are so low. But only 6,000 tests, I think. India has conducted only 6,000 tests.
I'm not sure about that.
Yeah, that's about it. India has conducted only about 6,000 tests, and you have 159 people with the virus and 3 dead. And my question really is that if this is a pandemic, shouldn't they be conducting more tests?
Yeah.
We don't have the capacity. We don't have the testing kits, or whatever be the reason. But you don't tell me it's a pandemic and you shut down everything, and then you tell me that not enough tests are being done or can be done.
They have to start working on that.
Yeah.
We know, like even Sikkim cases are being sent to Guwahati.
That's how it is, yeah. That's how it is. I mean, even when you go to one of these diagnostic centers, anything halfway complicated goes off on a courier somewhere else, and the results you have to wait for. But something like the COVID-19, I think... I'm not saying that anyone should be able to walk in and get a test done just to kind of feel better. But I think the present scale, the numbers that they're testing is just not adequate. If you're telling me that it's a worry.
So we've just got an update saying that from the center, 276 Indians who have been infected with COVID-19 abroad, including 255 in Iran.
Okay, they are stuck there itself.
Sorry?
These are Indians who are stuck there
Yeah.
in the isolation wards there.
So it's been surreal. First, let's talk about the experience, right?
It's surreal. I mean, I've seen enough zombie movies to know this was coming.
Though to feel like you are actually in a zombie movie has been like
A post-apocalyptic scenario.
yeah.
Yeah, this shutdown is. I'm surprised that they're being able to pull it off across the world.
Mm.
I mean, if this had not happened, and someone had written that this could happen down the line when we watch the movies, we don't really take them very seriously.
Mm.
But it's happened. I mean, countries are shutting down, and it just keeps getting smaller from there. The country shuts down, then a state shuts down.
Mm.
Its borders, blocks of people.
And hopefully, if we survive this,
Oh, please, let's not get there.
no, it has
Everybody is
also
going to survive this.
this
More people are going to die of swine flu and diarrhea in our
no,
country.
this
than-
pandemic has also highlighted the ill preparedness of so many governments, like not just in India, not just like across the world.
Across the world, they've been cutting budgets from healthcare, and it's telling now.
Yeah. So let's look at what the state government, Sikkim government, decided. When was it? On 16th March, day
Mhm.
before yesterday,
Yeah.
and rolled out a slew of announcements. And what it basically shut the state down. Right?
Yeah,
It,
even the domestic tourists.
yeah, earlier it was just the foreigners that they were denying.
Yeah, which I could not really understand.
Yeah,
I mean, I think Sikkim should stop differentiating between foreign and domestic tourists.
yeah.
Guests are guests.
Gets, I guess.
And if you don't want to be hospitable, it should be across the board to everyone.
Mm. So it has banned the entry of domestic tourists till 15th April.
Given that Western tourists were already banned
Yeah.
from entering.
Subject to improvement in the situation, that is. So they
Yeah.
might be extended for this
Hmm.
deadline.
Mhm.
That's like so.
Timeline. Let's not use those kind of words when we're talking about COVID-19.
Also, the government advised people of
People.
Sikkim to avoid traveling outside the state,
Mhm.
and unless
And
it is
if you
in-
do,
Hmm.
please travel with all your documents, because again a notification has come out today that Sikkim is returning will need to present their
IDs.
IDs.
And he has also advised people to avoid traveling to neighboring hills, and also shut down public places such as cinema halls, casinos, pubs, discos, gyms, hotels, melas, and
Hotels, because you don't have
festivals,
tourists.
schools, colleges, universities,
Yeah.
till 15th April.
Hmm.
And students should also not travel. I don't know why that has been put in. Should stay in
Because
Sikkim
you
and
have a
people
lot
traveling
of
outside.
because a lot of students in Sikkim now are from outside the state, so they would, if everything is shutting down for a month, they'll be going home.
Okay, yeah. And Malli and Rangpo will be the designated checkposts for screening. Rambam, Reshi, and Uttare checkposts will be closed, which will have some manpower for the two designated checkposts. I really don't understand what that
They'll
means.
pull people away from those checkposts to man these,
Mm.
the ones that are open.
And the tourism guest house at Rangpo has been turned into a quarantine ward, and similar arrangements are to be made in Malli as well. Government will procure testing and all required equipments, and even the SICB center in Karfektar,
Mhm.
what is it? The
No.
State Institute of Capacity Building at
Yeah.
Karfektar has been turned into a quarantine ward,
Isolation
and
ward, yeah.
immediate constitution of state level task force and district level task force to tackle the situation. State task force will comprise of Principal Secretary Health, Principal Secretary Tourism, and Director General of Police, while the district task force will be headed by the DC. Chief Secretary will be overall in charge of the state and the district task force. And interestingly, pharmaceutical companies and other industrial units were also requested to shut down.
Yeah.
And
And what was the next point?
And right after that comes the points where it's is stated that the health department will procure emergency medicines to avoid any shortage in future.
From shut factories. But I think they've reversed that.
Yeah.
I think they've, because come on, I mean, a factory manufacturing pharmaceutical drugs is probably one of the most sanitized, hopefully one of the most sanitized, safe spaces when it comes to germs and viruses. You don't ask them to shut down. You ask them to come and give classes at government departments and how they can match similar levels of sanitization, isn't it? So I think that was very short-sighted. But they've turned that around, I think. I hope.
All essentials and food commodities will be stored, and complete ban on entry of laborers into the state till the situation normalizes. Those laborers who are already in the state should not travel out of the state.
Under house arrest. They are under house arrest.
Yeah.
Under state arrest.
So those are the basic decisions that were taken on 16th. And
what do you think about them?
I have become very fatalistic.
कुछ भी कर लो, कुछ नहीं होगा.
No, because
No, I get that. I mean, when I first kind of heard of these measures, I mean, as you would know in the office, I was not at all convinced of what was being done. Primarily because these are measures that you take that you take in worst case scenarios, right? That you have the virus in Sikkim, it is spreading, and then you shut down everything, right? But I don't know how informed these decisions were. Just because every state in India was doing it does not make it right.
Yeah, to counter that, I mean, I think there is no
harm. Yeah.
In the sense that
I've come around that.
You've seen like one case leads to like in a few you detect one case today, and in a week it will jump to like 50 or 100.
Yeah.
So that way is as a precautionary measure.
Yes.
I mean, precaution is better than cure.
I'm getting to that, right? So initially I was very angrily upset with what I thought was poorly informed and short-sighted, right? Then I've come around it to understand that what they're trying to avoid is what is called stage 3 infections. Now, stage 1 is when it jumps from the animal to human. Stage 2 is when it goes from an infected person to another person, when you know the history of that person's travel and things like that. And stage 3 is what is called community transmission, where you don't know who has the virus, who's shedding the virus, and like it just explodes from there. That is when it explodes, right? So what starts off on week 1 as 2 cases, by week 3 you've got numbering thousands. So you're trying to avoid that. I get it. My point is why you should have done a lot of other things simultaneously, and why these kind of measures distract you or shift the attention, shift the focus from what are the very, very real measures you need to take. Now, one is, this is your nuclear deterrent, right? This is your Brahmastra, the final weapon you deploy when the virus has spread, and then you shut everything down. You've done that now, till April 15th, 1 month. There is no telling till when you'll have to continue with this, right? What will happen, and what has been established in other such scenarios, is that you come up with something known as intervention fatigue. How long are you going to sustain it? How long are you going to just block the borders, keep the people in, keep the kids in school, keep the kids at home, and just hope that nothing bad happens, right? Because in none of these measures is anything on preparedness. You cannot just tell me get emergency medicines and get done with it. My point is, the first measure should have been to check what kind of facilities you have, build that infrastructure, make sure that you have enough ventilators or medicines or ART drugs. Nowhere are we being told whether we have enough. I think health department by now should have told us how many ventilators do they have in the state. I don't think they have too many, right? So what are you going to counter that? Just keeping people in quarantine is not enough, right? They need to be treated as well. Do we have enough protective gear for the health workers? Have they been briefed on what protocol to follow in the hospitals? What are you going to do if the hospitals are going to be overwhelmed by COVID-19 cases? What is going to happen to all the other patients that you also have? That is already being seen in Italy, where 86% of the hospital beds are occupied by COVID-19 patients. What happens to the other people who need health care? Have you reached out to people and told them that should they go to hospital for routine procedures? Where is that level of awareness or information being transferred? So, I mean, and what has the government told me? What are they doing to spread awareness or keep the people most at risk of a fatality safe, which means the elderly? Has any attempt been made to reach out to them? So these are issues that and when you do all this, your entire energy, your entire focus is diverted there. And I think what are the questions of immediate concern are being sidelined. So that's my only worry. I mean, you tell me, there are some countries which are thinking that the entire academic year will be cancelled. Are you prepared for a scenario like that, where, let's say, April 19th, you'd shift it to May? On what it also does, my problem, what also it does is at a very... across our country, the government is washing its hands off. The moment you shut down schools, the moment you shut down restaurants, hotels, tourism, everything, you're telling the people that now if you get the virus, it's your fault. Yeah. And the moment it's your fault means the government has only that much liability when it comes to your treatment, right? You can, you're shifting blame, right? The typical, I would say, Sikkimese attitude, but in this case, it's also a national kind of condition, really, right? Yeah. You're telling the people that, boss, now you're on your own. If you get the virus, it'll be your fault because we did everything to keep you safe. I don't think that's the right approach.
Yeah, I'm not so sure about that. I don't know if I agree to that. But I do agree with your point that more is being done. I mean, at least maybe it is being done. Maybe the health department is
maybe it is
going out and doing. But
for me, they should have told me that this decision, this very strong. I mean, do you realize you've shut down the economy for a month, right? In peak tourist season. I'm not saying you should have allowed the tourists in. I'm not implying that, but you should have told me why this was the only thing you could do. Why the schools had to be shut down. Where is the virus in Sikkim? You cannot tell me कि अरे आ सकता है तो बंद कर दिया ना. You shut it down now, right? Let's say Sikkim has no COVID-19 cases till April 15th. And on 16th you have the first case. You again shut down everything for a month. No. Where is the plan? Where is the informed plan?
I am kind of getting what you're saying. So, getting what you're saying in the sense that if you putting the blame, responsibility on the people to take care of themselves,
which they should, right? I'm not saying that the government should look out for them, but
no. So they should have first. I feel not an expert, but let's say, like you said, this is the Brahmastra, right? Yeah. That you launch at the last. I mean, as the last step of protection. So maybe it would have been nice to see a first level of protection where they ensured that screening or on the borders they were doing it properly. We've been hearing a lot of complaints. We've been hearing a lot of complaints about how they think that the screening process is not being done properly. But at the same time, you've also said that how much can you do? Screening is a difficult. It's a complicated.
You will not catch anyone. I've not heard of anyone being caught at these border screenings for COVID-19.
No, we haven't. See, I was just thinking, there has been no community intervention till now. It's been a week, more than a week, 2 weeks. In the sense that if it's such a big deal, COVID-19, then every house, every household there should be government agents or even non-government agents coming and informing, telling people do this,
social
do that.
Distancing. Are you crazy? That I might be absolutely safe at my home until this guy comes and gives you okay. So there is that problem with this disease, right? It's an isolating disease, and but I get it.
No, but some kind of as soon as this thing broke out, we got that ringtone, whatever caller tune on the phones, right? Which is
which makes you think that the person you're calling has got a cough.
Yeah, but something like that, even if it is just tokenism, even if it is just, we haven't, except for these decisions that were taken, like uh, like
Yeah. So
the IPR department should have been going on overdrive, making small spots for COVID awareness, let's say, or that kind of
yeah,
effort.
I think everyone is talking about what is the word they're using it for? The pandemic panic, which is sweeping across the world. So I cannot have government officers and elected representatives saying don't panic, and then doing this.
No, you,
Right?
yeah.
You shut down everything. You're in virtual kind of lockdown.
So,
You,
yeah.
and then you say don't panic.
I have a problem.
People will panic.
I have a problem with the fact that the government is saying everything is, we are prepared, we are prepared, we are prepared, don't panic. But how are they prepared? We are not sure, right?
No, they're not prepared.
Let's say I was thinking, let's say even, I have been thinking for a few days now. We have been coming to work. I know some people, government servants, who are hesitant to go to work. They are feeling, they are panicking,
They would.
right?
They would.
So, in case, even even us, if we somehow the situation worsens and we have to stay at home, what about the services like water, bijli? Last time I was thinking, if something, if
you got to start watching
if there's a storm,
Zombieland, The Road, movies like that to kind of get your tips on how to survive.
No, if there's a storm, let's say, and this is the season, right? A hailstone, whatever aayega. And then the lines are down, and then there's no one to repair.
No, there are people. The government offices are there.
No, I'm saying
What
if it is
in
in the extreme situation of zombie-like situation.
I know.
So there's been a small glitch again, and a lot of stuff that we had recorded was not recorded. So we are we are recording this portion of the podcast on, what is the day today?
19th March.
The next, we had recorded a podcast yesterday, and so this is a continuation. So there's certain things that we discussed yesterday that there have been some developments. So we'll start with that particular topic. We had discussed about this teachers who have been deputed for CBSE paper evaluation duty in Guwahati, and from Sikkim. I had a friend who had brought this up day before yesterday. She had said that I really don't want to go, but there has been no communication from the department, so there is nothing I can do. I have to go, otherwise I have to pay 5 lakh fine.
Individual,
Yeah, so that is why we had discussed how, like, that is the day before yesterday, the government had announced that a list of decisions, and one of them being advice to Sikkimis to not travel outside the state. And despite that, the teachers had not received any communication that they are supposed to cancel their trip to Guwahati. And so she left yesterday. And yesterday itself...
Last night.
Sorry.
Late night, isn't it?
Late night, yeah. Yesterday morning, early morning, she left. She was hoping that she will get some information from the education department here saying that cancel ho gaya trip and all that, but she didn't. So she left early morning, and late in the evening we got this notification from the CBSE saying that schools have been shut down, whatever, exams have been postponed, and then even this evaluation has been postponed.
Yeah, obviously, if the exams have been postponed, what will they evaluate?
Yeah.
But what is frustrating is the education department every day touches a new nadir when it comes to lack of empathy. I think if teachers, this was a concern. I don't know how education department was not aware of this, because a huge number of teachers are going to be moving for this particular task in Guwahati. If the teachers, they should have been in touch with CBSE all the time.
Yes.
I think whoever is responsible, and I think the entire department is responsible for not having addressed this issue. They should have been in touch with the teachers. They should have been in touch with CBSE. If the teachers had to go, this is something we had recorded yesterday as well. If the teachers had to go, a message should have gone out to all of them, telling them that sorry, We tried to check with CBSE, but you have to go for the evaluation duty because there's been no change. And these are the precautions you should take. Make sure that you take these precautions. These are the phone numbers you should call if you need assistance from Sikkim. Why should Assam look out for Sikkimese people there? It did none of those. It did not even communicate to them. They should have confirmed or told them to wait. We are still hoping to hear from CBSE. They didn't do any of that. And the teachers just had to proceed. I think the education department should have said, don't go.
We will pay the fine.
We will pay the fines that will come on you because we are empathetic towards the situation that has been created. It did none of those. It is inexcusable, All these teachers have gone out.
Yeah.
If coronavirus is really a risk, and if that is the reason the government of Sikkim decided to shut everything down, then it is not enough for them to say, oh, they'll come back in one day. The virus is like...
they have been exposed.
If they were to be exposed, they have been exposed with the few hours or one day or whatever, the train journey, the bus journey, whatever terrible conditions they had to travel. And apart from the whole stress and trauma that they would have to go through, right?
Yeah.
There is no explaining what the education department has been up to. And this one was... A lot of other things we can laugh off and things like that, but this is like just inexcusable. This lack of... this complete disinterest in the interest of the teachers. If you're not looking out for the students, as you've seen for the last week, and you're not looking out for the teachers, then what are you really doing? Just responsible for the work orders and constructions that you're going to keep busy with, and some stupid national program that you want to convince people are such big game-changing events for...
Yeah, this was really disappointing, and disappointing. The education department was really disappointing. And this friend also, I was quite surprised that what she was worried about was whether she had no worries about going out, being exposed to coronavirus or anything. She was worried that once I go and when I'm returning, whether she'll be allowed back if the situation worsens.
I think the education department secretary and director and whoever is who call themselves the top honchos there should be at Rangpur to receive the teachers and make sure that they don't have to wait there for 2 hours to get screened. They should be given fast track access to the screening and brought in. That's the least they can do. They can go to Rangpur to receive VIPs all the time. This is their bungle. This is the least they can do.
It is... Yeah, it is sad.
No, how do you explain this kind of complete lack of responsibility? And now no accountability will be fixed either.
Yeah. Who was supposed to make sure that it was, that they were required to go? I don't think anything, they must have not done anything confirmed, because I kept telling this friend, confirm it with the department, because the government has announced that people should not travel outside. And she said no, and nobody's taking the initiative.
And why should the teachers have to be the ones who call up the department and ask them?
They should.
Apart from the fact that no one in the department will speak anyways, but it should be the department, right? There has to be a cell. It's full of these directors and directorates and cells at what have yous, right?
Yeah, you have that.
Come on, the department is headed by an additional chief secretary, which is like one peg higher than the regular secretaries. Such utter disregard for teachers. What do you do?
Yeah. It is sad. And teachers, of all professions, teachers should receive the most empathy and respect and everything else.
They do. Most of them end up in politics, right? Or most of the politicians were former teachers. But yeah, jokes apart. It just frustrates you.
Yeah, it is frustrating. And let's get over that frustration and move on to
something even more disturbing.
And that is, we had discussed yesterday about how the lack of community organizations, civil society organizations at the very grassroots level is...
at your mohalla.
So
level.
That is truly felt in these times of crisis.
In these times of panic buying and fake
Yes.
catastrophizing of the situation.
No, because we were discussing how if there were these locality specific organizations, let's say even like 10, 15 houses have come together, and then they figure out how to handle this crisis, right? How to address, how to get supplies, how to arrange for supplies, how to ration them, and
Yeah, even if they don't do all that, how to make sure that someone in need receives the
what, yeah,
supplies or whatever else it is that
yeah,
they require. The rest of the community comes together and provides it to them.
yeah.
And in the absence of such kind of spontaneous or instinctive coming togethers, you have shortages
Yeah,
and panic buying.
because yesterday after we recorded the podcast, we had discussed this, but unfortunately it wasn't recorded. So I did see this on Facebook. A man in Renok was distributing masks, I think for free, no?
Yeah.
He was distributing masks
I mean,
to,
apart from the fact that masks are not required anyways,
yeah, anyway,
but
masks was
gesture.
distributing to elderly and children, right? Which is a good gesture, but at the same time, that act in itself I'm fine
That's
with,
an
right? But it is
individual act.
individual act. So if that kind of effort was put by a community, then imagine the kind of things that you would be able to achieve, more you would able to achieve.
Yes.
So we were discussing that, and how we were also discussing the hoarding thing, that hoarding business, right? We know we don't have any hand sanitizers or masks available in the local markets.
Yeah.
I think that's happening around the world, but still,
Yeah.
in those cases, like, so you might have gone out and bought like 100 hand sanitizers, right?
I didn't.
No,
That's
no.
she's just suggesting that. I didn't actually do anything like that. Right? That's to illustrate a point. Yes. So yes, I bought 100 sanitizers then.
Yeah, and I was late, or I didn't think lazy. Yeah, I was lazy, and I have just one hand sanitizer, and that's about to finish, and I have like,
Yeah, and by the way, washing your hands 4 times a day is more than enough, is what the experts are saying. You don't have to do it every 5 seconds.
okay.
You'll be left with like.
But
just
we
bones.
have given a disclaimer that we are not giving any advice. We don't
yeah, we
know.
did that. Yeah, but
yet.
we can pass on stuff.
Anyway,
we've heard
so
on WhatsApp
coming back
University.
to the topic, so like we both live in the same locality. I go to the ration shop or the department store in our locality, and I buy 100 hand sanitizers, and then you are left with just one, right? And then, but if we communicated properly, I could lend you.
Yes, I
give
think
you-
by now, I'll give you the example of France, for instance. What France has done, and they are having a bad time with this. What the government of France has done, I think some other countries as well, they've nationalized the private hospitals, which means that all private hospitals are now going to be run like government hospitals, provide free treatment to people. That's the kind of pressure they are under. So we don't have private hospitals in Sikkim, so let's keep that aside. What France has also done is it's got in touch with all these perfume manufacturers, and they have many, and told them, no more perfumes, all of you
Will
manufacture hand
hand
sanitizers.
sanitizer.
We're not even
Thinking on those.
thinking on those lines. We are talking about asking pharmaceutical companies to shut
Shut
down.
down.
I mean, what world are we in?
Yeah.
We should be, and coming to your community organization thing, obviously it is not something that comes in overnight, right? You are faced with a crisis now. It's not like tomorrow you can form these things. These things have to be instinctive. The politicians of the day have to encourage these things to evolve. Just because a neighborhood wants to form a Gaon Sudhar Samiti doesn't mean that it has to be a party guy who runs it.
Yeah.
It has to be the guy that people trust, and party people are not normally people that you trust. So it has to be some genuine social organizations that you allow to happen so that they are effective, they're truly representative, and from there you can handle crises like this much better. Like we were talking about, I don't know whether that got recorded, because I don't even remember what was recorded and what didn't get recorded. When we were talking about the support groups, for instance, you were talking about, I mean, you must be part of some 2-3 WhatsApp groups, right? And out there is where it begins, right? So someone who's saying that I think I'm traveling a lot, I go to a government office. I mean, many of the people are already at home quarantined, right? Not quarantined really, but don't need to go out. But government servants do. So just like health workers, I think we should be looking out for them more, because they will be in public spaces.
Yep.
So a friend of yours who works in a government office doesn't have a hand sanitizer at hand. Someone else does. You share it with them.
Yes.
You pass it on to them. Similarly, if we have surplus supplies, we should be donating it to the hospitals and PHCs. I think hospital is pretty well taken care of, hopefully.
Yeah.
But PHCs, I think, are not. Right? No one is talking about what's happening in the PHCs. They do attend to people who are not keeping well. Has anyone reached out to these units?
Yeah.
Has the government done that? All these crazy task forces that they formed, have they looked out for what your grassroots level health
Workers.
response system has
Yeah.
in place? So, yeah, I mean, those are things that you'll have to do, because the next outbreak is going to happen very soon, right? Coronavirus will run its course. They're saying the vaccine will be ready in 18 months or whatever. That's the time it takes to test these drugs. But do you think we're going to get a coronavirus shot? We probably not, right? Vaccinated. By that time, something else would have come in. You need to have these systems in place. I mean, you need to have more responsive. And hoarding is not good, yaar. I mean, you'll be left with so many of these things that you'll not be able to use them by the time the expiry date comes around, right?
It is human nature, no? There's human selfish nature, no? You only think about yourself. You have kids. It's people who have kids start behaving like only they have kids, no? Like mere to banani cha, I have to take care. There are other people who have kids.
But that's exactly your point, right?
Yeah.
But if we had effective community groups,
I know.
then you would know that if I run out of something, I have this support group that will come to my aid. And if they can't come to my aid, then all of us are in the same boat.
Yeah,
it's not
and
like someone else is. Maybe you have a friend who can who can rustle up some boy.
sanitizers.
And hand sanitizer are not great, right? Washing your hands with soap and warm water has been
Better.
Has been established to be better. Proven to be better. Hand sanitizer is something you need when you're out, right?
Yeah.
If you're at home, you are better off just washing your hands with soap.
Yeah, so I was also talking about how last time I was also talking about how to use technology, we can use technology now, right? Because WhatsApp groups, to have these kind of civil society groups, WhatsApp is there, other media platforms, social media platforms are
TikTok
there. So
videos.
it's so easy to get people together, right? And communicate, okay, itna hai, whatever. And also in my WhatsApp group of friends, there were some people who were panicking, so we were telling them to not panic so much, and if you need help, we will help you. If you need something that we will give it to you. So we'll share, we'll manage, we'll work together. That kind of feeling has to be there amongst the general public also, like of working together, not just looking out for yourself, but looking out for others also. And this whole thing, I think this, in a weird way, this disease or virus is like a test of the human nature also, because if you are careful, you not just look out for yourself, but you have to look out for others also, right? You should, to make sure that you don't spread the virus to others. You isolate yourself. You tell the truth when you're traveling and say where you're coming from, or whether you have these symptoms. You don't hide your symptoms and then you go and infect like 10 other people. So those, I don't know, but it's
no, I think it is. I mean, that's the one positive takeaway. Hopefully, I mean, we're talking about social distancing. At the same time, this is also going to be the time when you feel the need for social coming together even more.
Yeah.
Because I was thinking the government offices are open, increasing number of nuclear families, but kids are at home. So you could share time, right? You could share time, taking turns looking out for the kids and not sending the kids out because everything is closed. Swimming pools have been drained and Palja Stadium is closed and Children's Park is closed as well. So yeah, there's so many things you can do to ensure that the right kind of message goes out.
Yeah.
And I think that is also going to be the strongest way that you can combat fake news. Right? You're not going to get it from television, because the television is just going to tell you how great Modi is. Or how scary this whole scenario is, but they're not going to kind of tell you how to deal with it. That has to be a community engagement, and I think that will really work if they do that. If not for the present crisis, at least for the next, because there's another one building. I mean, that's what
It's
the world has
inevitable.
come to be.
And
and what do we have to say about what has been the state's response so far? Or did we cover that in our
We
previous
have covered that. You have a long
rant
rant.
against it? Yeah, but it has to be seen in context, right? I mean, because I think like a lot of the measures are necessary, especially because our health infrastructure is so busted that it can't take the inflow of patients and things like that. So, but the takeaways, I think, when that news came about of that COVID-19 scare is there, so the government has set up district level and state level task forces, district levels to be headed by the district collectors, state level to be headed by the chief secretary. And it's good, but at the same time, it's so obnoxiously routine.
Yeah.
Every time something happens, they form we formed district task force for Swachh Bharat Abhiyan, whereas that should have been something that NGOs looked out for, not government departments, right? But you have the DC sitting in that as well, and the chief secretary heading that as well. So just about every initiative, they just know that you have to form a task force.
Oh yes, I think we missed this portion of the discussion. I mean, we have lost this portion of the discussion also, in that we are supposed to have recorded yesterday.
Yeah.
Was how these task forces are manned by like multiple task forces, or multiple responsibilities are given to one person, and
Ex officio, just because
huh.
he's the DC, he sits on every task force.
Yeah,
But
that,
just because he's the chief secretary, he sits on every task force.
yeah. So how?
No, but that's crazy, right? I mean, that doesn't make sense. Because if you shoulder a person with 100 responsibilities, from VIP protocol duty to disaster management to cleanliness to school management committees,
Yeah.
to sitting on school boards, to looking after the essential supply. I mean, like, they're human, right?
Yeah.
So something as worrying as COVID-19 that no one understands, and now is the need for them to kind of distill accurate information from all over the world. You need to have a dedicated task force, which means, I mean, I would want the district subdivision, I mean, go down to the ward and panchayat level for all I care, but the district level task force and the state level task force should be manned by people with exclusive responsibility to that task force, and they're sitting in nothing else. So don't have the chief secretary there, don't have the DC there.
Yeah.
Let the DC escort the chief minister every time he travels through their district in the gadi or whatever, and sit in every other meeting and go as a chief guest wherever and go and supervise whether the streets are being cleaned or not. But when it comes to COVID-19, have a dedicated team of people who are just communicating.
Yeah.
You need to be communicating with Delhi, with West Bengal, with WHO. I don't know, with the University of Pennsylvania or whoever it is that is doing something about COVID-19, trying to understand what the virus is, what new have we learned about the virus, how to keep people safe, whether a certain plan is working or not. You've shut down Sikkim. We don't know whether that works or not, right? How can you shut it down more effectively, or do you need to shut it down at all? Those kinds require a person 24/7 dedicated to that task.
Yeah.
Not someone who's got too many other things on his plate. Then it will become tokenism. Then they'll just wait for whatever Delhi tells them, and they'll just change the masthead from Ministry of Home Affairs and make it State Government of Sikkim and pass it on to us, right? They will not be informed or customized responses for
So
Sikkim,
what
which is what
happens
is required.
I think it is what happened with the teachers' evaluation duty trip to Guwahati. I think it is very क्या बोलते हैं उसको?
The task force should have looked into that, no?
That tells you what concentrating power in one man or one officer does, because I'm sure the teachers must have
Yeah?
brought it up with their
Immediate supervisors.
immediate supervisors and all that, right? But then they cannot say anything. They have to put it up to the secretary and then they wait, and secretary is busy with this
And that
disaster
guy's priority
management.
is not the teachers, right? Because he's not traveling to Guwahati.
Yeah, I just don't understand why
Whereas
it can.
You tell me, isn't that something that should be the lookout of a task force? It is not just how to keep Sikkim safe, it's to keep Sikkimis
He's
safe.
safe,
It's
yeah.
not territorial, it's people, right? And an entire tribe of people moving out of Sikkim should have rung alarm bells for them and said,
Yeah.
"Ki, are we going to do this?"
And the culture of the government office also, no, I just ऐसे ही होता है, like सरले भन्छ, सरलाई सोध्नु पर्छ, सरले, and then nobody has this.
Maybe we should have more madams. No, but yeah, that it just won't work like that. This should, I mean, that's just one example. There's so much more.
Why couldn't the supervisors, any one bloody supervisor could have taken the risk, suppose it, and said, don't go, मैं अब देख लूँगा, मैं बात करूँगा सेक्रेटरी के साथ. कोई किसी के पास कोई क्या बोलते हैं, जिगरा ही नहीं है.
It's not about jigra. It's not, doesn't take courage to do what you're required to do, right? Like that we cannot put a virtue to doing the right thing, right? That's your job. You've been trained and paid to do.
I have a feeling
exactly
I haven't
that.
spoken in detail to this friend because it was like this WhatsApp chat and we couldn't really talk properly. But she did, one sentence she wrote was that nobody's taking the initiative, she said. I have a feeling, so these teachers brought it up with whoever, one officer said, वो तो अब पता नहीं मेरे को तो वो तो दिल्लीले हेर्छ कि त माथि सोध्नुपर्छ, त्यो त मलाई थाहा छैन. You know how it is, government offices, you go to one place, they say त्यो त मलाई याद छैन, उहाँ सोध्नुहोस्. That must have happened, and that is what I am suspecting she was referring to. You cannot have that attitude in times like these, no?
Yeah. I think these top level officers, no, they should be just there to collect awards and bring it and submit it to the chief minister or their minister or whatever and go to all these functions and whatever. But the real work, and because our mid-level bureaucracy is like kind of wasted in Sikkim, they should be given the real responsibilities like task forces and this and that and separate groups, right?
Yeah.
For every kind of project or initiative, if you have separate task groups with that guy responsible only for that, I think that's the way to go. And and because I think even the health sector needs a relook. I mean, it's been requiring a relook for I think decades now, but now is the time. Now is the time. I mean, like we want for the health department to come up frankly and tell the people of Sikkim that this lockdown is necessary because if more than 10 people, I'm just throwing a number, right? Because I think it is as low as that. If more than 10 people come down with COVID-19 symptoms and require a ventilator, you're not going to have the facilities to look after them, right? So we're looking at scary scenarios like that.
Yeah, I wonder if they do say that they are acquiring the equipments, everything is in place, we are prepared.
The government of India,
but I don't know.
India doesn't have the equipment, right?
Yeah.
And you see, China is the manufacturing hub of the world. If China says that I will produce 1 lakh ventilators in the next 1 week, they have the factories and the facilities to do that. India mein tender hoga, someone will bid, someone will be giving goose, and by the time that equipment comes, it will be obsolete and also not required, right? So we are looking at a scenario like that. So how do we kind of sidestep that? Because the other thing that I feel very strongly about is for the health department to also set up a communicable diseases cell, which is, they probably already have that.
Yeah.
But this is a dedicated team, right? It is not someone who is in a transferable job that they're there for 6 months and go off somewhere. A team of communicators and doctors in that team who train in real life situations. My hope is that you have this team. It can go down to whatever level, training of trainers or whatever you want to do. Send the group to Kerala, which is the only state in India that has handled this well.
Yeah.
Because they've been at it for the last 20 years at least. It is a very informed democracy as well, so that helps. Community organizations are very strong there. So you go there and learn from the health minister and the health department of Kerala on how did they manage this.
Yeah, I think the health minister should call up the Kerala health minister, who is a she and who is supposed to be very good at her job, obviously. So, just one phone call just to get some advice.
Tell us what to do. Go to Kerala, learn, see what can be adapted in Sikkim, what can be done here, prepare a plan of action, and like we had discussed yesterday as well, you might do such a good job of it that UN will give you some money and then you can travel to Congo, which has managed to contain Ebola, right? They've made their mistakes, they learned from it, there was panic. It's done the entire course, right? There was fake news, there was people running away, quarantining was impossible at one time, but now they've fought it back. You go there and learn from them, right? So that you don't repeat their mistakes, and then you can customize those projects for Sikkim. Because trust me, every expert has been saying this. We are a global village now. However much you might want to make it about local, non-local, and thinking that you can shut down Rangpo and keep everything out, it is not going to happen.
Yeah.
India is not going to. You cannot keep pulling off these stunts every time, right? You cannot go into a lockdown for 1 month with no economic activity and not feel the repercussions for it.
Yeah.
So you should have the confidence and informed and confident and well-trained personnel at hand. When this happens again, they will tell you what to do. And that will be the right way to do things. How do you combat panic? How do you spread? Fake news can be combated so well by community organizations, right?
Yeah.
That can be your source for all the accurate information and things like that. I mean, like, shouldn't they be attempting all this? I mean, because right now, if the virus comes here, there's nothing new you can do, right? You've got the same sort of nurses. You've not been hiring nurses for donkey's years. You're short on nurses. You're probably short on doctors. The country is short on doctors and nurses. I don't think that's going to be any different for Sikkim. You're short on emergency facilities. Converting a hostel into an isolation ward is something you do in emergency situations. You can't do it all the time. There have to be better plans in place. So you take this as a learning, as an opportunity to learn and see how you can build on it. I think that's the way they should be doing it. And don't then train someone for a year and then transfer them to, I don't know, culture department or mines and geology, right? You need experts, and you need people who feel for this.
So I think we should end our podcast now. But before we go, I think...
And pray
No.
that it has recorded.
No, we have... it is recorded. Definitely recorded. And I would like you to share again, because it did not get recorded yesterday, the incident with the man with the marks.
Oh, yeah. Oh, there's more, because today I had another experience. But I'll tell you what happened yesterday. I'm sure it's... So, everybody is wearing masks, right? A lot of people are wearing masks. And but I don't think they understand why they're wearing masks. So, I was coming into office yesterday, and at this spot on the footpath where it's kind of a raised footpath. So, you 3 steps down, there's a medicine shop. And so you're walking almost above the medicine shop, and it was crowded with people. And this guy walked up, and I noticed him because I notice people with masks nowadays, right? And that person just took off his mask, and I was wondering what he was doing. He took off his mask, and then he let out this phenomenal sneeze. I think he sprayed everyone around him for kind of a radius of 10 feet or whatever. Everyone in the medicine shop was just kind of stunned into silence, because I think they felt the droplets. They were all staring up at this guy, and then he put his mask back on and walked off. And I said, like, what awareness, right? What happened to the elbow thing? What happened to the need for people with a cold to be wearing a mask and things like that? So that is what has happened. And to contrast that is something that happened this morning as I was coming into office. I mean, a lot of things happen when you come into office, apart from all the rumors you hear in the share cab. So there is this person that I kind of run into often. I think our timings match or whatever. And whenever we cross, he shakes hands with me.
Okay.
So today I came across him. I'm not a handshaking kind of guy. And it struck me later, right? So I offered him my hand to shake. He had not, later I realized that he had not put out his hand to shake with me, right? So I put my hand out to shake, and he shook my hands with his wrist, right? He would not open his hands. He kind of gave me his wrist to kind of...
Rub?
To rub. Yeah, no, let's not call it rub. Now even shake sounds weird. But he offered me his wrist, and...
Did you offered your wrist?
No, but I had already my hand was already open, so like... I very politely kind of shook hands with his wrist, and which is a good thing, right? If he had just done namaste, my hand was already there, like I could pull it back.
No, like how is him not giving his hand and giving his wrist going to save him, right? It's there on his body, your virus.
No, but he does not rub his face with his wrist. See, the virus travels from your hand to you when you touch your face, right? Your eyes, nose, or your mouth, right? So...
Yeah, maybe.
And that is, I guess, the safest he could be without being rude.
Very soon वो पैर ऐसे देंगे ना, they'll offer their foot shakes.
Yeah. I think those head taps are gone now.
Oh, let's not go there.
Okay, let's not go there. Okay, that's a very, yeah, but so that's what I've been seeing around, yeah. And it's good. I mean, one was almost comic.
Yeah.
The other was.
The first incident, I think he didn't want to infect himself with his own.
But that's the whole thing. I think the only way coronavirus can be fought is if everyone's like, see that right now the response, and this is the selfish gene, right?
Yeah.
Everyone is thinking about how to keep themselves safe.
Yeah.
I think the only way we can fight the coronavirus or any other future infection is if everyone says, how am I not going to infect anyone else?
Exactly.
And that is the only way, I
Yeah.
think.
Yes.
We've become experts.
Yeah. That was a high five. And on that note, on that positive note,
Yes.
keep safe and keep others safe.
Yes.
Yeah.
Thank you.
Thank you so much for tuning in. Please like and subscribe to our YouTube channel, like our Facebook video, like our podcast on Spotify, Apple Podcasts, Google Podcasts, and various other platforms. And please write in to news@summittimes.com if you don't like it, if you like it, and we will hopefully be back soon.
Yeah. I'm recording it.